By our Executive Vice President of Strategy and Transformation of Hartford HealthCare, David Whitehead. Welcome so much.
Thank you. Thank you for having me.
We are glad to have you, and we're talking a lot about transformation with healthcare today. There's been a lot of work over the past decade. Let's talk about leading change and what we've done over these last 10 years.
Sure. So, I always like to start any one of these conversations talking about what's the intrinsic motivation that gets us to change, right? And that gets us to transform, especially in healthcare. So if we think about it from a healthcare perspective, every single one of us have a personal story or have had a personal journey around healthcare.
It touches all of us.
It touches all of us. And, mine really began with my mother. I was just coming into being president and CEO of a local community hospital where she was being treated for multiple issues, but she had just had quintuple bypass surgery at Hartford Hospital, and she was discovered to have lung cancer in that process. And it was a very short term illness for her. Within 12 weeks, we lost my mom to lung cancer. And when that was happening, what I began to see was there was an uncoordinated aspect of her care and her transitions from one, tertiary acute care facility to a community-based acute care facility. And everyone with best intentions were trying to do the very best they could, but there was a disconnect that I witnessed kind of being on the other side of as the son, not as, a healthcare executive. And I was able to witness it in a different way. And what it did was it furthered my intrinsic motivation around how can we transform healthcare? How can we transform our system of care to better serve anyone, regardless of what their health status is at that point in time? So as you know, Rebecca, Hartford HealthCare today, we stand by a promise of helping people live their healthiest lives. So that really grew out of that process that I lived through in that patient journey, my mom's patient journey, back in 2009. So here we are 10 years later, transforming ourselves, and I think you used the right word, is really about change management. How far, how fast, and what are you trying to achieve? And our vision to be most trusted for personalized, coordinated care, a lot of that grew out of individual personal journeys in healthcare. And I think as I think about transformation today, we're kind of at an interesting intersection, right? We've transformed, the industry has transformed itself. There's transformation that's taking place around the healthcare industry and within the healthcare industry. But really, what's that next generation of transformation? And where I've landed on that is transformation driven by innovation. So as we start to think about what are the next opportunities to help people live their healthiest lives, it's really in precision medicine. It's in genomics. It's in the innovation that's being driven by artificial intelligence and machine learning, and how we can utilize data to actually personalize the care for an individual so that we know, and they know, most importantly, what their health status is and what they can do to improve health status, or at least define health status for themselves, given the conditions that they may live with.
And I love that some of the things that you're touching on, so many different health systems have these pockets of excellence, and you're saying even 10 years ago that was true, but moving that forward so that it was more cohesive. One of the things that you've been passionate about is exporting expertise so that you didn't have to go to the larger hospital, which you still might have to at some point in time, and that's great, but that you could export that expertise to all of the others. That's been a big driving part of the strategy.
Yeah, that's really been a big part of Hartford HealthCare's strategy in the way that we envision care delivery. And it's really around three component parts: access, expertise, and community. And what we've driven through our integrated healthcare delivery system is we want to open up access. So today, we have over 370 points of access across all of Connecticut, central Massachusetts, and southwestern Rhode Island. But I heard an interesting statistic last week. While we have 370, what we'll call them access points, we're entering the residence of individuals 3,355 times a day on average.
Wow.
So when you think about transformation and you begin to think about transformation being driven by innovation, you have to start to think about where will care be delivered over the next 5 to 10 years. So we're really proud. We have an exceptional, high-performing home care organization that spans the entire state of Connecticut, but it's home care in the traditional form. As we begin to look at these new innovations that are coming forward and the use of artificial intelligence and machine learning, what might the opportunity be for those 3,355 people that we see on a daily basis outside the four walls of an acute care hospital, outside of the four walls of a physician office practice, outside the four walls of an urgent care center? What can we do in the home? How can we transform care delivery within the place of residence as we go forward?
And that's going to be happening more and more.
Absolutely.
We're touching folks. So you're giving a talk in the near term about omnichannel approaches
Right.
to healthcare. And from a marketing perspective, that's definitely a part of how we're reaching folks as well. Tell us a little bit. I mean, we've talked a lot about consumer activation, innovation, even being a part of the LinkedIn
Exactly.
beta testing is a part of that innovation. Talk a little about what does that mean, consumer activation, making sure that our patients are able to reach out and touch us in unique and different ways.
Yeah, and I think this goes back to, we have in the industry for years talked about patient experience. And now patient experience in many quarters of healthcare has moved to customer engagement / patient experience. We've really focused in, and you and your team have been a big part of this process, around how do we activate consumers? So we serve 1 in 3 Connecticut residents on average every day.
Wow.
2/3 we're not serving. How do we activate those consumers to actually embrace what we've built within Hartford HealthCare? And the consumer activation part of that is this omnichannel approach. What we're doing right now is an omnichannel approach that will convey what Hartford HealthCare stands for, what Hartford HealthCare is accomplishing within the geography that we serve. But we know that consumers activate with different industries and in different. Omnichannel approach is utilizing technology, utilizing LinkedIn Live, utilizing Facebook Live, but still utilizing a multimedia approach.
Absolutely.
And I think a great example of this, and I was asked this back in September, happened to go to a concert at Xfinity Center here in Hartford, where Hartford HealthCare is the sponsor of what's known as the VIP tent.
Okay.
Right? So we're the sponsor of the VIP tent, and people said, wow, that must cost you a lot of money. And I said, no, not really. Well, why do you want to sponsor a VIP tent? I said, it has nothing to do with what you see as the sponsorship and the display of our brand and mark. It has to do with the geofencing that's taking place
Right.
through Live Nation, which happens to be the organization that runs the Xfinity Center. So in real time, as people are within this concert environment, when they're taking out their phone and they're clicking on to do something, we now can communicate with them directly about their particular interest.
And help them live their healthiest lives.
And help them live their healthiest lives, making that connection. So for us, we think the consumer journey, which leads to a customer engagement, which eventually will be a patient experience, starts at that very core of maybe I'm just looking for information because maybe I have a family member or a neighbor or a loved one who's dealing with a particular healthcare situation at that point in time. What information can I get? What knowledge can I get? And we've built that infrastructure within our team here at Hartford HealthCare to be able to give consumers the opportunity to activate in any way that's comfortable and relevant to them. So it could be very traditional, but it could also be in a very new, innovative way through applications.
And I love that. We have some, I do want to remind folks that if you want to ask Dave questions, we're here, we're happy to take your questions. One of the things that we do in this sort of venue, and we do it on other platforms, we bring in physicians so people are able, exactly what you're saying,
Exactly.
we have this activation that physicians are here, people ask questions, and we can, I think that when we looked at the last year, we had 40,000 people actively reach out to us because of the work that happened in this studio.
That's great.
40,000 people saying, I want to learn more about what you're talking about.
Right.
It's amazing.
It is.
Christine has been on LinkedIn and she said, I love the idea of AI when used for improving healthcare. So let's talk about that. That's a focus. We're getting closer. We use it right now, I believe, for cardiac care. And
We do, and we're currently engaged with MIT, Massachusetts Institute for Technology, in driving algorithms
Amazing.
based and utilizing the data within that to do three very important things. One, to open up more operating room capacity within Hartford Hospital, our tertiary center. Two, to look at length of stay and what are some of, I'll call them the barriers to reducing length of stay, which is actually in the benefit of the patient.
And I think that's
a
important
shorter length of stay.
to point out, because we want you to go home. You actually do better as a
Exactly.
patient when you're
Exactly.
home.
And third, in our emergency department, looking at throughput in that process. So the artificial intelligence that comes off of that algorithm because of the
amazing.
data that we're collecting, then we can operationalize and make really smart, informed decisions about how we improve that patient experience within those three areas. So once this is piloted, and we're deeply engaged in this process right now, we'll be working with MIT on how we can expand that across the entire system of care.
Very exciting. Lots of exciting things that are happening. Thank you for being a part of our LinkedIn Live beta testing. So all of the things that happen here, we actually then send to LinkedIn so that they can learn how to make LinkedIn Live even better. Thank
Awesome.
you.